Dr. Zymantas, when a person has a toothache, does that always mean a root canal? And if it does, tell us a little bit about it, about root canals and toothaches in connection.
Well, most of the time when a person has a toothache, the cause of the toothache is due to usually one of two things. The primary one is decay, where the tooth rots away, and as the rotten part of the tooth approaches the nerve, which is inside of the tooth, then that creates a reaction inside of the nerve, inside of the tooth, and that your body says, hey, this is pain, something's happening, I need something done soon, or things are going to be a problem. Sometimes there is no pain associated with people that will potentially need root canals. The other factor that causes pain is fractured teeth, and fractured teeth are that's a little bit less often than decay, but it does happen where the fracture occurs and the fracture breaks into the nerve chamber and the nerve is exposed, and somehow when you bite down, you kind of open and close the door, and every time you open and close the door, you're sort of pinching the nerve. So that causes a reaction to the tissue. When a person does have discomfort in a tooth, the sooner they can get into the dentist, the better, because it may be where all they need to do is place a relatively inexpensive restoration of filling, clean out the decay and put in a filling if the decay has not gone too close to the nerve. But if the decay goes too close to the nerve or into the nerve chamber, then what we need to do is do what's called root canal therapy. And root canal therapy is where we take the nerve that's inside of like a tube inside of the tooth in the root canal. We use special files to clean out that nerve in a proper way and then seal it off so bacteria cannot kind of go back and forth from the bone and back into the tooth and vice versa. So the purpose of the root canal is to kind of like sedate the tooth and more or less like entomb the problem and so that the bacteria cannot create a reaction in the area.
Okay. So a root canal these days still, I mean, everybody fears a root canal. It's, we make jokes about everything we do, root canal is, it's like going to the DAX office, or going to the DAX office is like doing a root canal, and, anything which is unpleasant, we compare it to, it's like a root canal, or it's almost like a root canal. But hasn't technology changed that really isn't true anymore?
In most cases, getting a root canal is no different than getting a filling. We have anesthetics now and techniques that will be able to sedate the nerve. Unfortunately, on occasion, there are nerves that are just what we call very hot, and they're very inflamed, and the inflammation kind of neutralizes the anesthetics, and in some cases, it can be a little bit uncomfortable for some patients. But overall, in most general cases, root canals nowadays are very routine and create minimal to no discomfort.
And of course, at the very worst in your office, you put the patient to sleep with your
exactly.
Sedation.
If somebody does have a hot tooth, sedation is an excellent treatment to help them get through the treatment, and we also have medications not just to sedate the patient, but also to help control the pain.